fine, Mo. What's the matter?
Can you beat that? I had to give an enema. Of all things.
Yes, of all things, an enema. Prescribed by the medical officer, the enema may be the only means of supplying badly needed medicine and nourishment to sick bodies. It often brings swift relief to the sick and injured, preoperative patients, those dazed by shock, or those tortured by burns. Of several varieties of enemas that may be ordered, there are two main types. First, the retention enema, ordinarily given to provide nourishment or medication. For this, use a fairly small pitcher because the amount of solution will be small. You'll need a funnel and possibly a rubber tube and glass connecting tube. Use a thermometer if you have one to be sure the solution is at body temperature, about 100 degrees. The rectal tube is small and short, so the solution may be injected at the minimum pressure. The second main type is the evacuant or cleansing enema. It is given to induce evacuation and to clean out the bowel. A larger enema can will be needed because a larger amount of solution is used. It is given at a higher temperature, about 105 to 110 degrees. The rectal tube is larger and longer, so that greater pressure is produced, resulting in an increased irritation and desire to evacuate. This much of the gear is usually kept set up and ready for use. Select a large, firm rectal tube and attach it to the glass connecting tube. Get the soap solution and pour about 2 ounces into the pitcher. Fill the pitcher with about 1 quart of water. Be sure the water isn't too hot. What you want is a temperature of about 110 degrees. Transfer the solution to the irrigating can. Now you're ready to lubricate the end of the tube. Put the lubricant on some tissues and then wrap them around the end of the tube. Don't forget the toilet tissues. Get a rubber pad and a towel to protect the bed. Screening the bed will prevent your patient from drafts and give him privacy. Put your equipment down and take the trouble to explain exactly what you're going to do. The patient should be lying almost flat. Remove all but one pillow. Lower the top cover. You'll keep it clean and give the bedding a chance to air. If there's no rubber draw sheet on the bed, put down a rubber sheet and towel and draw it under the patient's buttocks. Then, move the patient into position, preferably on his left side with the right knee bent. This is known as the left Sims position. Put the bedpan under the covers at the foot to keep it warm, and place its cover under the mattress at the foot of the bed. Place a kidney basin near the patient. Check the rectal tube to be sure it is well lubricated. Unclamp the stopcock. Air bubbles will get into the tubing, but you can get them out if you'll hold it high above the can. Lower the tubing gradually until the solution begins to run out, and then pinch it off, either with your fingers or use the stopcock. Now, gently insert the rectal tube from 4 to 6 inches. Hold the can about 12 inches above the bed. If held much higher, the solution will run in too fast and cause cramps. So watch his face. If it registers pain or he complains, pinch off the flow until the cramp passes. Then resume. Do this as often as necessary until the can is almost empty. Then clamp the stopcock so no air will enter into the tube. Put the can back on the tray and withdraw the tube in this fashion. Now turn the patient over on his back. When you slide the bedpan under him, make sure it's in the center and straight. Then raise the head and foot of the bed so the patient will be more comfortable. Be sure to set the toilet tissues within easy reach. Call his attention to the signal cord and have it near at hand. Now, if the patient can be left alone, cover and remove the gear from the unit. While the patient expels the enema, you'll have just about enough time to clean and stow the gear you've used.
Hiya.
You just gave a retention enema, didn't you?
Yeah, a couple of hours ago.
You gotta hang on to it okay?
Sure, why?
Well, I gave one this afternoon, too, and mine didn't.
We had a nurse who taught us in chorus school who used to have a regular sing-song chant about enemas. Went something like this. If the enemas have been given slowly enough and at the right temperature, with the right amount, right kind of fluid, with the right tubing and the right psychology, they will be successful. We used to get sick of her little spiel and her surefire righteousness. Seems to be about the truth at that.
I'll have to remember that.